All of us should be interested in overall health and certainly cardiovascular health. And so today is going to be just an overview. We're going to talk about heart health. I have a big word up here on the screen called atherosclerosis. There will be a test. Everybody will have to say that word later and be able to spell it. Atherosclerosis is simply hardening of the arteries. We can depict in images arteries here that begin to develop, plaque, a buildup, and hopefully not ever, but a clog or a blockage of the arteries, which we know as stenosis. And in the heart, that would be called a heart attack. In the brain, it would be called a brain attack. No, we don't call it a brain attack in the brain, we call it a stroke. But that can happen anywhere in the body. Just today, I saw a patient in the clinic that had just had to have what's called a bypass, where they had blockage in the main arteries that go to the lower extremities. This same process had been happening over time, and they developed what's medically we call it claudication. What people know in general life is it hurts when I walk. My legs ache or they're sore. They not just that they fatigue out, but they actually get where I can't go anymore. And that's just because there's blockage in those arteries. In this case, the person had a blockage on both sides, over both legs. Well, of course, 60 years of smoking didn't help that at all. Quit 5 years ago, but damage was done. But anyhow, my goal is, as the primary care doctor, is hopefully we won't ever get there. Heart disease is definitely the leading cause of death for both men and women. That data has been true now for the last, has it been maybe 20 years or so? I forget the exact date. But we used to say breast cancer took most women's life, but now it's actually heart disease or vascular disease. In 2013, these are the latest statistics from the American Heart Association. This is how many people's lives it took. Things seem okay until it's not okay. And you can see the graph behind this little skull and crossbones that 2/3 of women never ever had any symptoms before they had a massive event. And in men, about half of men have never had any symptoms. No idea that they were having any problems. And then you can see, 750,000 Americans have heart attacks each year. Statistics are just crazy. This is dividing up between men and women by age from left to right. It's not just the older you are, the more likely, but actually it peaks out in men, the blue bars, between 55 and 75 is the most at-risk time for men having an event, a heart attack. This looks at black men are more at risk than white women from top to bottom. Here, just restating the same thing. So, the Framingham Heart Study is the oldest cardiovascular study ever in the northeast of the United States, started back in the 40s. And these are definitely known identifiable risk factors. Some of these are controllable, some of these are not controllable. You don't have a decision over your age or gender, but you do over the rest of these things here. We can control all these things. Like the gentleman this morning, it was a little late after 60 years of smoking. So this is American Heart data from 2015 looking at the estimated 10-year risk of having a heart attack. And this is just based on a few things. Gender, of course, then based on blood pressure, cholesterol, diabetes, stratification. And I don't need to go over the specific data, but most people already know, hey, if your cholesterol is high, you have a higher risk of having a heart attack or a stroke. So we're back to the things that we can control, and I want to talk about that in general. One thing that's never talked about is stress. Stress is not really hardly ever talked about, but it probably affects more people's lives in areas other than just cardiovascular disease than anything. Anxiety, depression, weight gain, fatigue, overall energy, all those things are affected by stress. When I'm talking about stress, it's not just, do you get anxious or you stressed out, but sometimes it's over commitment, too busy, too many things you're trying to balance or juggle at the same time. not getting enough sleep at night, not getting enough restorative recharge at all during the day. That could be improved by meditation, by prayer, by your own time out, by some sort of means to give your time to take that break. I mean, even Jesus himself took those breaks. Why would we think we don't need some time out like that? There are certain supplements. I'm not going to review tons of these, but lots of these things can help. This is a natural cholesterol lowering supplement that maybe someone who has mild disease can benefit from. This is a supplement made from a plant that helps improve and has been scientifically shown by electron microscopy or by video electron microscopy to improve the lining of the arteries of the blood vessels. Remember that first picture? You see the blockage and stuff starting to happen. Well, in the lining of the arteries, there's little fingers, or there's little, the medical word is a glycocalyx, but the lay word would mean like little fingers that stick out into the arteries. And that's healthy to show the ability to your arteries aren't just passing, it's not like a pipe. I mean, arteries are alive, and they can constrict and relax, and they can release hormones and do all types of things. And the little fingers, the presence of those indicates a good healthy state, if you think of it like the lining of your intestinal tract. If you have, a stomach bug and you're going to the bathroom, the lining of your gut isn't all right. So you need to do things to help improve that. Well, you can do that same sort of thing with your arteries. How you eat, the antioxidants that you consume, superfoods is what they call the greens, barley green, things like that. Well, this Atherosclerosis has been shown to help improve the glycocalyx of the arteries. So how do you know if you have heart disease? You can go to your doctor, you can check a blood pressure, we can check the elasticity of the blood vessels, just like in a little, a clown, one of those little balloons that they'll blow up. When you stretch out that balloon and then you let all the air back out, it doesn't contract all the way back down. Well, your veins can do the same thing, and the arteries are thicker walled vessels, and they'll tend to contract down a little bit better. The wall's thicker, there's a muscular layer in arteries, and both are important for different reasons, but you want your blood vessels to have a good resiliency whenever your heart pumps and beats each time. So we do a test called a max pulse to check that. We have a couple other ways, but that's one way. Number 4 up here is carotid artery, that's your neck artery, intermedial thickness. There's a little ruler up there, and we actually measure by ultrasound measurement to see the thickness of the lining of the neck artery. What we're trying to do is pick up early disease, early onset of disease, so that we can do something about it, change lifestyle, adding in exercise, or whatever that may be, to affect a positive change. In our Heart Smart program, we do many different things. We look at the abdominal aorta, we do an EKG, do a breathing test, do a limited left ventricle heart ultrasound, check some measurements, sleep, stress, other things, and including some labs, checking cholesterol, of course sugar. There's some inflammatory markers, the CRP. In early 2019, the American Heart Association and the American College of Cardiology came out with some new recommendations. Not just checking the traditional lipid or cholesterol panel, screening for diabetes, that sort of thing, checking, waist circumference, checking, those types of things, but also consider checking this HSCRP, number 5 up here. Also look at checking a test called the homocysteine. Consider checking what's called a Lp(a), which is lipoprotein A, and some other biomarkers, one called an apolipoprotein B, ApoB. So these markers can then be taken and risk stratify a particular person into a low, medium, or high risk of an event. So a person that's a low risk, keep doing what you're doing. You're doing good, fine. Someone that's in a high risk, oh wow, we need to go do a stress test and have the cardiologist check out the function and make sure there's, nothing happened in there that we need to intervene. If you need to deal with that, do supplements, do medications, lifestyle interventions, okay. But what's new this year, the first time the American Heart has said, we need to take those intermediate or medium, we don't know risk patients, and we need to do further checks on them. So this year is the first time the coronary calcium scoring test, which is done right here locally in Beaumont. It's an ultra-fast CAT scan of the arteries around the heart. It's $100 or something like that. Some insurances pay for it, some don't. And it's a look to see, are they developing evidence of atherosclerosis or disease? If they are, you need to be a lot more aggressive with that. If you're intermediate risk and we're not sure, then maybe we have a little more time and we're not as quite as aggressive there. So in HeartSmart, we want to look at someone's overall risk. We want to look at someone's whole. It's not just a, hey, run a test and tell you what you got. Look at a person holistically. And that's truly what we try to do here at Gerstenberg Clinic. Let's talk about exercise. Everybody knows you need to do some cardio exercise, aerobic exercise, 20 minutes, 3 times a week, sustaining your heart rate in that 130, 140 range, something like that, is pretty much, almost everybody can do that. If knees or hips don't hold out, then we can say, well, maybe you need a pool, or maybe you need a recumbent bike, or maybe one of those glider things where you get your arms and your legs moving, but it's not so knee dependent. It's not pounding so much. There's always a way to get one's heart rate up and to exercise the large muscles, increase the oxygen flow, increase the blood flow by exercising. There's some way to do that. And then we get into, well, how do I even do exercise the best? If you're limited on time, then in physiology reports are showing now that high intensity interval training is actually very helpful. It's not just a time-saving thing, but where you take someone and get them into the aerobic zone and then have them do a real exertional activity even while they're exercising, and just go all out, like you're jogging and then you sprint for 30 seconds. You can get the heart rate up and sustain that for 20 to 60 seconds and then come back down just to that regular jogging pace again. Again, that can be done in any exercise modality. It doesn't matter whether it's on the street or treadmill or swimming. It can be done with typically what we call strength training or weightlifting. Of course, you're doing lower weights at that, but you're getting the heart rate up. And that's when your body says, hey, we need more demand. We have more demand. Let's get more supply of oxygen. So when someone's doing an high intensity interval, that person's not on their phone texting, they're not talking, they're focusing basically on just being safe and existing and breathing. That's the level of intensity of exercise someone needs to have. And even in probably the most fit individual, you don't need to go more than about 60 seconds during one of those intervals in their exercise that they're doing. Back down to stay, not go below their aerobic threshold. And most people's aerobic threshold is somewhere in that 130 beats per minute to 140, something like that. There's formulas, there's even MVO2 testing we can see to tell specifically when someone goes into aerobic exercise, and then in going into those interval trainings, that's when we push someone into anaerobic metabolism. And there seems to be something about going into aerobic exercise and then into anaerobic exercise and then back into aerobic exercise, and then we switch that on and switch that off, the anaerobic part, and then staying in the aerobic zone. That seems to really be the magic of how you optimally exercise. That improves not only calorie burn while exercising, because you're exerting more, but post-exercise thermogenesis, which means you're generating more heat, you have more blood flow, you increase the after effect of exercise even better. That improves natural growth hormone production, which, remember, growth hormone is what babies have to grow up. That's how babies grow. Babies that are growth hormone deficient, they never get very tall, they don't get big, they don't grow, they have lack of strong muscles. In adults, growth hormones can be relatively deficient because we don't exert ourselves. We don't need the reparative, restorative process that happens when you demand that through strength training, through aerobic, through HIIT or high intensity interval training. So those things actually make your body, the pituitary, release growth hormone and induce that reparative, restorative process. So growth hormone is very healing, but you want your body to make that naturally. Another way to produce growth hormone is by getting deep, restful, optimal sleep. Down in the deep stages of sleep, there's awake, and then there's twilight, or almost sleepy, and then the twilight sleep, and then we have REM, stage 1, 2, 3, 4, and REM sleep. When you get down in that deep restorative sleep, that's when your body releases its growth hormone. And so if someone never gets down into deep sleep, they're not releasing their own natural growth hormone. They're not releasing enough, because we talk about sleep cycles. Sleep cycles happen about every 2 or 3 hours. A person that's asleep goes through different sleep cycles. They go down, and then they come back up into lighter stages of sleep, and then they go back down into deeper stages of sleep. And the average person should get at least 2, if not, but really optimally 3 sleep cycles. So when we talk about someone needing 8 to 9 hours of sleep, that's optimal. You're getting 3 sleep cycles for that person. And that person's, yes, getting deep restorative sleep. That lowers one's stress, that lowers one's natural cortisol levels, but it improves that restorative hormone, your body's healing potential to affect everything. Not just having energy through the day, or not yawning through the day, but healing your damaged body, or strengthening your muscles, your workout to do better, or that actually helps with what we call as an anti-inflammatory or anti-inflammation. So maybe you don't need to take as many meds for inflammation, where you hurt, where you ache. People that have all kinds of inflammatory conditions, whether it's arthritis, skin conditions, neurologic issues, all those issues are addressed by really just getting sleep. So when someone comes into me and they're a train wreck, they've got 58 symptoms, we talk about stress and sleep. Those are the 2 main things I'll always start with. And then we could talk about other things. Talk about lifestyle, and talk about, blah, blah, blah. And then we talk about supplements and then medication.